I now invite the next speaker, Dr. Amit Dey. He's going to talk on the topic Agentic Intelligence in Diabetes Care, Enhancing DSME and CDSS through Generative AI. He's a consultant diabetologist and obesity metabolic disorder. He is a MD, FACP, FRSH, PhD, UK and USA. He's a diploma in geriatric medicine and diabetology, UK. He works with Apollo, Eden Health Plus, Kolkata. He is a founding chair of Doctors AI Empower Type 1 Diabetes and a founding fellow American College of Artificial Intelligence in Medicine, founding for Follow Diabetes India. He has several awards and qualifications under himself.
I think,
I welcome you. Yeah, it's a very long
list. Let's make the better utility of the time by discussing artificial intelligence. Okay, so. Dear friends, I'm actually speaking on this topic possibly for the first time in a diabetes conference. We are talking about agentic AI in diabetes care, so this is kind of a premiering of a topic. And I know we have a mixed literacy of AI in the house, so I'll try to keep myself as simple as possible and as contextual as possible so that everybody makes meaning of what I'm. If you have been seeing the developments that's been happening about the AI world, the first thing that's happened is generative AI came into existence, right? It's the context in which you're able to generate content, text, audio, speech, video. What Dr. Alok just generated on Mitra was generative artificial intelligence. Now as generative AI is evolving, we are looking at an ecosystem where multiple agents as in AI agents, will be able to work simultaneously and not just bring out information from the entire IoT, but from multiple smaller external resources of layers. That's called RAG, or retrieval augmented generation. And this is where a powerful automation process comes in, and that is called agentic AI. And this is the era of agentic AI, and as we get more and more into generative AI and artificial general intelligence, we'll see more and more agentic AI solution coming into the existence. So we are making an intersection of medicine and technology, and we'll try to explore if agentic AI can help us do some work in diabetes management and diabetes care. So this is the burden we all know, and we often know that, sometimes we preach a lot on Saturdays and Sundays in our conferences, but at the end of the day, when we go back on Mondays to Fridays to practice, we are not able to implement that because there is a need gap. We have to deal with more patients, etc., and the resource gap is there. The digital window is sometimes very small, and it's not enough. So there's a burden, and this needs to be answered, and possibly we will be able to do a lot with the artificial intelligence. Let's understand a few terms before I dig into agentic AI. So what is generative AI? Basically, they are models that produce new content. They're able to generate new content. Agentic AI is basically an ecosystem that has autonomous capability of functioning on its own at multiple layers, and I'll explain this as I go along. Diabetes self-management education is what we all know, and we know that it's one of the basic core of getting the patient empowered. And the other terminology that we will all get ourselves familiar with is clinical decision support system. So it's going to be an ecosystem or a software that analyzes the patient's data and recommends evidence-based action to clinicians or patients. So now how can we have all these four sections in one segment? So let's first understand the difference between agentic AI and AI agents. Now, for example, what Dr. Alok showed you, Mitra, or what we had built earlier days was Madhu AI. These are AI agents. They are discrete software entities that execute specific tasks within the broader agentic AI system. But agentic AI refers to overarching capability of an AI to autonomously sense and act towards a specific goal. And this makes this particular ecosystem very, very powerful. So it drives long-term adaptation, manages complex scenarios, multiple complex scenarios, and it's able to adjust, learn, relearn, and then implement. That's where agentic AI comes in. How has AI evolved in the segment of diabetes? So we have Dr. Debashish here from Medtronics, and he will tell you all the story about how fuzzy logic and rule-based system came into the pumps. Then we now have the hybrid closed-loop pumps, which acts on the PID mechanism. Parallelly, machine learning came into existence, and then we had clinical decision support system coming in. And of course, Professor Moshe Philip from Israel, who is the chair of ATTD, is one of the person who has developed the DriaMed clinical decision support system, which has received FDA clearance as a first autonomous insulin dosing CDSS. Now, let's see if we can have generative AI and CDSS cumulatively into the ecosystem of agentic AI in the days to come. So we run a deep research of literature. Every time I present, I run a deep research on artificial intelligence platforms. We took all the literatures that was available up to 31st of March, and this is what we have culminated into. Now, how does generative AI supercharge diabetes self-management education? Dr. Alok just showed you, right? Conversational learning, adaptive curriculum, and data-driven personalization. Multiple languages get it more and more personalized as you prompt it. The better you prompt, the better is the intelligent system output coming in. And most importantly, it doesn't fatigue. Always on 24/7, it gives you the response. So generative AI works. It takes in the data, it ingests it, it synthesizes a pattern, learns a pattern, and then it gives a prediction or it generates a content. It can give you personalized guidance, it can give you predictive analytics of how your sugars are going to go ahead. That's also generative AI in a way, and of course give you more and more educational content coming on. Along with generative AI, we now also have a system called RAG. What is RAG? RAG is retrieval augmented generation. So what happens in generative AI? You're always pushing back into the IoT or the ecosystem of the transformer architecture, where the foundation model is there for the information. But in RAG, you basically create an external authoritative knowledge base. It can be a PubMed database. It can be a database of your EHR or your patient's history, from where you're extrapolating the information coming out. So that's what RAG is, and generative AI and RAGs can work in parallel in a agentic ecosystem. Is there science behind it? Is there evidence behind it? Take a look at this particular paper that was published in JMIR in 2024 that looks at this RISE RAG chatbot. And it shows that the accuracy of the chatbot was quite good, and it was compared with the GPT-2 as well as with the Gemini platform, and it showed that if you build a RAG system with a local knowledge server database, then it performs comparatively better or even similar to a large language model, foundation model, or transformer architecture. There was a lot of meta-analysis done, and this was one paper that I picked up that took a multiple meta-analysis, and it pulled the improvement with chatbot. So you always know that these AI agents, and there is evidence to tell us that these AI agents can actually improve the patient's compliance and the bring improvement in their HbA1c and control of glycemic status by giving better around the corner diabetes self-management education. So empowerment of the patient is what we are talking about, and we have literature that speaks about that. This was the DIA LLM, which was another paper that looks at the voice of the patient. So like, how many of the patients are adopting it? So this was the result of it, where 86% of them would said that they will give a positive endorsement to peers of using this DIA LLM for patient education. Now, how does agentic AI come in? So what is a decision support? A decision support is, if the blood glucose goes high, it's going to give you an alert, both to the patient as well as to the clinician. And the clinician will work in tandem with the ecosystem to give a kind of an inference or an intervention to the patient. That's how the CDSS should work, right? Now, if you put agentic AI into this, it can have multiple layers of autonomy. First, it can give only advices. This is usually what the CDSS are currently doing. Second, it can recommend a plan, or it can start executing with confirmation if it is acting autonomously in an ecosystem, under constraint, under supervision of an endocrinologist also, or a diabetologist, it can start working. Now, this is actually a possibility with agentic AI coming in. So you can have multiple layers of autonomous work happening. So the next question that you will ask me, then where will we people go? Are we going to get extinct, or where exactly are we going to fit in? So this is exactly where we need to understand how this ecosystem can actually evolve and then fit ourselves into it. So a clinical decision support system is something which is kind of a RAG, but it has got multiple data interoperable connections coming in. So the knowledge base is there, the inference engine is there, the patient data comes in, the data comes in from the CGM, the pumps, the wearables, and then it throws out a recommendation to the clinician or to the patient going forward. One such example is DriaMed Advisor Pro, and this was developed in Israel, and this is the only FDA-approved, insulin dosing algorithm, which is a virtual endocrinologist for type 1 and type 2 diabetes. And there are a couple of papers which are published, and they give very good positive outcome of using this particular tool as a clinical decision support system. Now, how can agentic AI enhance this clinical decision support system? So clinical decision support system is there, okay? It's there in the ecosystem, it's already available. How you can add an agentic AI to the workflow to improve this? First, it will act autonomously to give a more proactive and predictive outcomes. It will work in multiple layers with RAGs and multiple agents, so it will be able to interpret complex data in a better way, especially in the field of healthcare, which is important. Now comes the question of autonomous tasking, and there will be the question where the human in the loop is going to go if you automate too much of it, and how much of a barrier should be put. Most importantly, it will have the capability of adaptive learning, so it will continuously refine its model and recommendation based on the real world, individualized, personalized patient outcome. So this is where agentic AI will come into the picture. Now, there are some transformer models. Transformer architecture are basically the foundation models of any language model that you use, and it processes multiple and a huge source of data parallelly in a dynamic manner, in a sequential way. That's what makes it so powerful. Now, we have also some research that tells us that there are some transformer architecture like the patch TST and the crossformers, and there are a couple of papers I'll show you right after this slide, which shows that its capability of predicting blood glucose levels is very, very good. So you will see these come more and more into the insulin pumps and into the continuous glucose monitoring system as we go along. So this is one of the paper I was talking about, which is a prediction using agentic AI, and this used the transformer called JPEF, and it has got multiple technicalities to it, but I'm not going into the depth of it, but to give you an understanding, if you enable a CDSS with a transformer architecture in the form of an agentic AI, then possibly the output is going to get far and far better. More autonomous, yes, but with the right guardrails and the human in the loop, it's going to work almost in an ambient ecosystem with the clinician happening. The other one was patch TST. So what is patch TST? It's a transformer-based deep learning model which was designed for multi-horizon blood glucose prediction that leverages patch-wise tokenization of time series data, just like we get in a CGM, to improve the prediction accuracy over a longer time horizon. So let's like you do a 14-day CGM and it gives you a prediction of 30 days. If you use an agentic AI solution behind it, the prediction accuracy is going to go further better. And these are some of the publications that's there on it, and it's worth exploring it. So this is the transformer patch TST that I'm talking about, and you can see how it's going to be able to predict with the technicalities behind it. So with the DriaMed, the response from the primary care physicians, the endocrinologist, was very positive. And factors which influenced adoption was data consolidation, reduction of error, more ambiently fitting into their workflows, and time saved on dose titration, because a lot of tweakings can be done with the agent and the CDSS coming in. But the concern was black box, unexplainability, responsible AI, alert fatigue, and medico-legal liability. Who is responsible if the AI gives a wrong prediction or a wrong dosing? So this was the summary of the clinical decision support system of the DriaMed, which does go on to show that it gives a prediction of improving the micro and the macrovascular complication going forward. Now coming to the last part and the hypothesis that how agentic AI can actually fit into this CDSS ecosystem is something like this. So first it's going to ingest the entire data, pre-process it and integrate it at the core with an agent somewhere in between, and ambiently work in parallel with the clinical decision support system and the chatbot which the patient is using. But the data privacy and security and federated learning, that is learning from the models, is very, very important. So this is a mind map which I have created, and we'll possibly take this into publication as we go along, of how an agentic AI should work in the field of diabetes care. So you have the core agentic AI here. It's driving the information from the knowledge base, the patient-specific data, the RAG, the retrieval augmented generation from the CGM data. And it's also taking the inputs from the clinician through the CDSS of the insulin dosing, the lifestyle adjustment inputs made by the doctor in the EHR, and from the patient, from the chatbots which the patient is constantly using. So from all these sources of input, the agentic AI and the core can actually learn, iterate, and perform autonomously in guiding both the clinician and the patient to stay in the ecosystem in the best fit approach. Possibly then we will be able to solve so many need gaps in diabetes care if we can incorporate this. But it's a very challenging thing to do, but it's worth a technology that we can look at. There's going to be challenge with federated learning. I mean, interoperability is going to be a big problem, and data sharing will be a problem, because the whole thing is going to work only if there is ambient data sharing at each level. So what could be the problems? The problems could be explainability and trust. The problems could be in data interoperability. This is why these days every solution should have an HL7 and FHIR compliance, and we are looking at more and more compliance in the CGMs also getting interoperable with the insulin pumps and vis-a-vis with the electronic health record. Bias will be a challenge, and that has to be taken care, especially the training data set bias. But again, as more these solutions gets developed, we will see. And regulatory pathway, there will be a whole new game coming up, and I think Debashish will be the best person to say how it will go in terms of FDA classes, etc., as we go along. So what could be the recommendation from the clinician side? So if agentic AI has to come in, if it's, for example, an educational nudge, like a chatbot with a low risk of harm, it can go as an auto push. If it does a moderate, like it tweaks the basal dose with the CGM integrated, EHR integrated, then it should intimate the HCP before it confirms. That's how the agentic AI should work. And if it's a high risk, for example, changing the bolus in diabetic ketoacidosis, then it should have a sign-off from the human in the loop. So this is the ecosystem that we have to work towards in building when these agentic AI solution comes in. A lot of problems, stakeholder co-designing, explainability will be an issue, continuous monitoring, bias audit, and privacy will be a need. Going forward, we are looking at the digital twins coming in, long horizon RCTs with the doctors involved. Federated learning is going to be very important in healthcare, especially in diabetes, understanding of diabetes healthcare data, and taking care of the burden, the psychological outcome burden is very important as we go along. So the key take-home message of what I wanted to tell you all is that with agentic AI, generative AI is going to get more and more powerful, but as doctors and clinicians in the loop, when these solutions are coming, we have to have the human oversight and make sure that there is transparency and explainability at every path going forward. This is the references which I've used to make this entire presentation. This is not a science fiction movie. There is enough evidence and literature behind it. And before I end, I will invite all of you to join us in the Doctors AI Global Summit. It's not just going to be on diabetes, across the entire spectrum of healthcare and medicine. And this is happening in Bangalore in November. So please scan the QR codes, register and join us. They will talk about many such fascinating technologies coming into medicine as we go along. Thank you so much.
Thank you very much, sir. I invite the other two speakers on the stage, and because time is low, we can have one question for each of the speakers. And if the audience want to ask any questions, I do welcome. So, Amit sir, you said about DreamMed. I just wanted to ask something. I also just looked about it. So, one thing that came to my mind is, like, if a patient is on multiple daily doses of injections, like a type 1 patient, and he's doing finger prick values SMBG, so how can DreamMed help that patient? Is it possible?
No, so DreamMed is, as I said, see, these clinical decision support system will best work when they are connected and they're interoperable. So
you need a CGM.
Yes, it has to have a CGM, and especially the DRIAMED studies that you have seen has been done more on type 1 patients, with patients on pump CGM, then the entire EHR ecosystem connected to the doctor. So what's happening is there's a virtual endocrinologist that's monitoring the patient's pump data, CGM data, pushing in recommendations to the doctor, and then the doctor is signing off with the guidelines coming in. So that's where the clinical decision support system is coming in.
Yeah,
but yes, but with the existing DRIAMED CDSS, it's a static layer of learning. So it has learned and then it is recommending. But once Agentic AI comes into it, it will continuously learn. So every time, it will get personalized learning. So you as a patient, you'll have your own recommendation and own guideline because it's continuously learning from federated data. That's where Agentic AI will come.
Because when I was looking into it, I really felt like the need at the moment would be something like that, because
absolutely,
because 780G is already doing this.
Absolutely,
it's doing it behind. And so if somebody, on the other hand, if somebody is taking multiple daily injections and titrating that is a very difficult task. So if AI can take up that, it would have been nice.
Right. So as long as it doesn't replace us, that's important.
Eventually. Yes. So. Sir, one thing I want to ask, like insulin pump, is there anything in the pipeline with
a lot of pumps are there
in India? Indian-made insulin pumps.
I hope other players also come. Now we have only Medtronic, but the next one will be fully closed. Fully closed means now the current 170G will still...
No, Indian-made because...
Indian-made, yeah. So I have evaluated in my last 10 years, I think 5 projects on insulin pump. 2 came for AID and I think 10 of them for non-invasive CGM.
Are they coming in the market soon?
But no. They failed, all failed in the initial clinical validation only. Okay. The major challenge of non-invasive, first challenge will be your non-invasive CGM is your skin color,
Correct.
Skin color, skin temperature, sweat, thickness of the skin. So most of the technology what's available currently, NIR, MIR, PPG, all of them have failed. Now the latest one what I have seen, they are coming up with NIR and PPG mix with AI/ML algorithm which will overcome the limitations of these technologies. Hopefully we'll get a non-invasive continuous glucose monitoring soon.
Sure.
Once you have that, that will be a game changer again.
Again, that is not succeeded yet.
I'm telling you, that's in making.
So this is where generative AI and agentic AI is going to make all these things successful, because it will constantly learn. Like he said, skin color was a problem because it was trained on a very skewed and a limited source of data, right? And what happens is if you put it in an ecosystem where it's constantly learning as well as performing, then the efficiency of that particular tool improves and sensitivity and specificity.
And my last point about pump you said, so there is an innovator in ISC, Indian Institute of Science, Bangalore. They are making an Indian pump, but then I asked him what the cost you are looking at. He told 2 lakhs. Just simple pump at 2 lakhs. I told it's not sustainable. Please work out again. And he forgot about consumables. So that's the problem innovators have. He didn't have any idea that consumables are needed. So I asked them, okay, go back and work out, and if needed.
So there's an opportunity to develop a pump. Thank you very much. I thank the speakers. Hello,
I'll just make one comment for the audience, and that is when you're talking of Agentic AI or any AI, it's like, when we were doing our residency, we learned in our residency, and we would seek institutes which have a high patient load and the best teachers, So the more marks you have, you get admission over there. Why? Because we get more material to learn. Even my daughter is doing surgery. The more cuttings you get, the more happy you are. So that is the problem. That is the advantage with AI. The more models you give, the more examples, the more training you give. It's like, adopting an AI is like adopting a 2,000 rupees per month or a very cheap qualified medical practitioner, a resident officer in your pocket, which improves over a period of time and gives you a better output, sometimes better than yours.
Eventually, I will replace this. Thank you, sir. Thank you very much.